We are live. We are live. I'm Dr. Frita. Welcome to Celebrity Health and the hot health topics in the headlines. It's Medical Monday. Good to see you on this Thanksgiving holiday week. Guess what? The holiday is here, but we don't stop with the news. We have a jam-packed show for you today. We're going to start off with those videos that have been going viral, and you'll see what happens when a woman's pain is ignored. You had two viral videos, two different states, two Black women in obvious active labor. They were each ignored. One was sent away from the hospital where she gave birth with her husband on the side of the road in a car 8 minutes later. The other lady's symptoms were ignored. And finally, when they got to her and admitted her, she gave birth 12 minutes labor. And so we'll talk about what's behind that. Is it implicit bias? Yes, it is. And then we'll talk about the CDC. Oh my gosh, y'all, the CDC, RFK Jr. looks like they've made a change on the message on the CDC website when it comes to vaccines. And so we'll talk about that and what you should do to make the best decisions for you and your family when it comes for vaccinations and health decisions. Then we'll get into my favorite little game, myth versus fact. And we'll talk about Reverend Jesse Jackson, the civil rights icon. He has been diagnosed with a rare neurological disorder, PSP, progressive supranuclear palsy. And so we'll talk about that, and we'll do some myth versus fact statements to give you some education on that. And then we'll get into your second weekly dose, where I give you a fresh take on medicine that you simply can't get anywhere else. And this time we're talking about the kissing virus, EBV, mononucleosis. Well, now there has been an earth-shattering link to lupus. Literally, they found that almost 100% of patients with lupus actually have it, likely due to a link to the kissing virus. Are y'all out there kissing? We'll talk about it. And then we'll talk about Joy Behar from The View and her iPad toe. I mean, she gives comic relief, but it's actually quite serious. And so we'll get into some of these injuries you can get by being attached to your tech devices and what to do about it. This is live, so you can ask me questions. I'll be asking you questions, and we'll all learn evidence-based medicine together. So let's get this thing going. It's Medical Monday. Welcome to Celebrity Health and all the hot health headlines we got for you. Hello, hello. Welcome to Celebrity Health and all the hot health topics in the headlines. I'm Dr. Frita. So happy to have you here. I'm not going to get into this discussion alone. I'm going to have my co-host and office manager, Miss Shador. Welcome to the stage. Come on up to the front of the stage, Miss Shador. How are you doing?
Hey, good, Dr. Frita. How are you? How's everyone?
Everyone is doing well, running around like chickens with our heads cut off as usual, getting ready for the holiday. Are you ready for Thanksgiving?
I'm navigating, so these seasonal allergies, food allergies, so they've kind of flaring up early. Things that I should and should not probably be eating due to a certain element that's found naturally. So I'm trying to have a couple of flares this weekend as well.
Oh, be careful, Shador, because you know what can happen. Sometimes if you have an allergy, it won't bother you this time. You can sneak an extra piece of this food that time. Mm-hmm. Then you can build up and have a big, dangerous allergy. And I'm thinking about your household. People have different allergies to different things. So y'all really have to be careful when preparing Thanksgiving. But I know you know how to navigate it, but just be careful, please.
Yeah, I won't be enjoying some of the things I really like to enjoy. I'm just not gonna do it.
Don't do it. But also, have a little Benadryl on deck and the phone and the ability to call if you need help. But yes. I hope you have an enjoyable.
We're ready. We're getting ready for the festivities. How about
Very
you all?
Good. Oh, I'm ready for Amara. She gets in a few hours from campus, and we're gonna all just hike and go and crash my cousin's house for Thanksgiving. My bestie cousin, Dawn.
Yes.
So we're gonna crash her house. So that should be a very enjoyable Thanksgiving.
All right.
And last week I missed you because we didn't have our Medical Monday. That's because I snuck off on a birthday trip. I was in St. Thomas, U.S. Virgin Islands, and had a really great time. For my members, though, I did give you a message. I gave you a message while I was out and let you know what was going on. And I still, for the members only, did a few videos and let y'all know what was going on. All right. Who was the first one in the chat?
First in the chat today is Miss Aileen.
Hi, Miss Aileen. How are you doing?
She says, good afternoon, everyone.
Good afternoon. All right, well, let's go ahead and get this thing started. Oh my goodness, Shador. You've seen those videos that have gone viral. There were 2 pregnant women, 2 different states, same dismissal, same poor treatment. And I actually was on the Don Lemon show on Wednesday, which was my birthday, November 19th. And so if y'all, after you finish this live, if you go to the Don Lemon show YouTube channel and you look at the post that he did at 2:00 p.m. on that day, and you'll see my face on the thumbnail, but I go into detail for a long conversation on medical mistreatment and implicit bias or unconscious bias. But basically, 2 different women in labor. It was so active, even to a layperson, someone who's not in medicine, and they were really dismissed, ignored. One young lady, Mrs. Mercedes Wells, was discharged after being in labor at the hospital for over 5 hours. They sent her 8 minutes later. She had the baby on the side of the road in a car. Another lady that sat there watched her scream in pain, and the nurse just was so cold and ignoring the patient and her pain and her labor, asking her all these questions that you can ask later. And she gave birth 12 minutes later, and she actually had something called meconium, which we'll talk about, which is a sign of stress, and that can really threaten the baby's life. And so it's mistreatment that both women were Black. So let's play a clip, and then I'm going to get your take on what's going on with these ladies in labor.
Right now. Is your What? How many times have you been pregnant? 3. This is your 3rd pregnancy? Yes. You have 2 babies. It's in my ass. You have 2 babies at home. Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this, or just the Black ones?
Everybody's a personalization for you. Last name is Jones. She's G3P2. I'm not sure when her due date is.
Her due date is the 10th.
It was the 10th.
She got 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors.
Okay. The video is loaded, and it's important. Of course, there's more, but it's important to listen to the entire video because you hear her screaming in pain. She's obviously in labor, and the nurse's reaction was cold. Even her asking, "Oh, we're not sure what the due date is," that's actually a loaded statement. One, she wasn't listening when they gave her the due date of the 10th, and there's just so much behind that. Like, this person was probably just out there, having intercourse unresponsibly, and to not know the due date also implies she just, didn't get any prenatal care. She's some irresponsible mom. There's loaded statements, and there's an inhumanity. And what I want you to know, and I want y'all to answer this question in the chat, and put in, if you can find one of the emojis, a little pregnant emoji. Y'all can find a little pregnant emoji. Put a pregnant emoji and answer the question: have you ever felt unheard by a doctor or a nurse or someone in healthcare? Have you, or someone have you ever felt unheard? Okay. And then Shador, I do want to play at least a little bit of the other clip, because that was one young lady, one state. And then here's someone else, Mrs. Mercedes Wells, if we have it, in a completely different state, same story.
My daughter's in active labor, and this is a Franciscan Crown Point being put out in active labor. So we got to transfer her to a different hospital while she's in labor, in pain. Unjust.
Okay. All right. So you get the gist, and you do see what the two ladies have in common. They're both Black women. And while some people might say, oh, well, maybe that's just a coincidence that they happen to be Black, but let's just talk about statistics. It tells us things that are a lot different. We know that the maternal mortality is more than 3 times higher among Black women when you compare them to white women and other ethnic groups. Black women are 3 times as likely to die around delivery. And people often wonder why. Well, this is why. There is a lot of implicit bias in the healthcare system. And so when I speak, I'm not just speaking from a place of opinion. I'm speaking from a place of studies, data, and data that is able to be replicated. Okay. So let's talk about what is implicit bias, what is unconscious bias. Well, it's when you have a certain prejudice or a certain treatment, often a poor treatment, a maltreatment of a specific group based on stereotypes or certain things that you assume about that group. Or if you have some type of a reason, or for whatever reason, you have a lesser humanity, or you value the life of that group in a lower respect than you do other groups. And we've seen it here in the United States repeatedly. There's been data going back as far at least as 2003, where a study was done, Institute of Medicine, and they found that when it came to Black people and other racial minorities, Black and brown people, they found that consistently their treatment was poorer than patients who were white. Okay. And this is something that I find really fascinating. In 2016, there was actually a study of medical students. Okay. Medical students were surveyed, and they found that many of the white medical students falsely believed that Black people had a higher pain tolerance. And when those medical students who had that false belief about the difference in pain tolerance were questioned, they said that they thought that dark people, Black people, had thicker skin and less sensitive nerve endings. And I can tell you, this type of a belief traces all the way back to the 19th century during a time of slavery, when those doctors falsely shared information that Black people had a higher pain tolerance. And this was used to justify unethical experiments on Black people. And we know about unethical experiments, also brutality. And so you might think, okay, why is something all the way back during a time of slavery still being perpetuated today? And that's because it's in the systems. It's in the systems. And so I will give you the update that the doctor and the nurse responsible for the second young lady in the clip, Mrs. Mercedes Wells, the doctor and the nurse responsible for sending her away from that hospital in active labor were fired. They were both fired. And the CEO of that hospital, Franciscan Health, Crown Point in Indiana, said that he's implementing a cultural competency course for all people dealing with patients in labor and delivery. And he's also going to make it so that a doctor must see pregnant women before they're discharged from the hospital. Because guess what? Mrs. Wells said she never saw a doctor. She was never examined by a doctor. A nurse sent her away. And here's the thing with the second lady. So we know that the first young lady who was screaming, it was her third pregnancy. The second lady, they're telling her she was in labor. She said her contractions were 1 minute apart. Okay, she knows what labor is. This was actually her fourth baby. And again, she was never examined by a doctor. And she had been in labor for over 5 hours. They actually had security to escort her and her husband out. And once they got out and they were driving to another hospital, they had to pull over because 8 minutes after being discharged from that hospital, escorted by security, Mrs. Wells gave birth to her baby on the side of the road. Okay. Her husband had to help her to give birth to her baby on the side of the road. And so with the umbilical cord still attached, they drove on to the next hospital. And so, yeah, the doctor and the nurse were fired. But again, these problems are systematic. They're systematic. And so let's see, do we have anyone to comment on if they've ever felt unheard, if they know of anyone who's felt unheard in healthcare?
Yes, ma'am. Ms. V.
Hi, Ms. V.
She says, many times due to my color, I always want to do a C-section, but refuse poor treatment.
Okay, the doctors want to do a C-section.
Always want to do a C-section.
Okay. And that is something, because even if you've had a C-section before, there is something called VBAC, vaginal birth after a C-section. And with C-sections, for the doctors, just being honest, it is predictable. You don't have to wait and have, time waiting with nurses, waiting with techs, doctor's time. You can just go ahead and deliver and it's done. And you can just kind of boom, 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 schedule someone, get them in and out, as opposed to taking the time and the care to deliver. And there have been complaints of women feeling like they're being pushed to do it. And a lot of that could be due to implicit bias or unconscious bias. Okay, thank you for sharing.
Audrey, hello.
Hi, Audrey.
Audrey says, yes, unheard during labor with my second child. Doctor told me I was early and was sure I was in labor. I had been in labor for 8 hours by that time.
Okay, so not listening. And again, we have the studies to show, and there's a reason why not only is the maternal mortality among Black women high, over 3 times higher than others, the newborns, Black newborns are 250% more likely to die than white newborns. Okay, this is not coincidence. Even when you correct for education, for wealth, for socioeconomic status, we know that Serena Williams has shared her story on how she felt like she was not heard and she had a blood clot in her lungs around her pregnancy, okay, a pulmonary embolism. And when we talk about maternal mortality, we're talking about death either during pregnancy or within a death related to the pregnancy within 42 days after the pregnancy being over. Okay. Beyonce has shared stories, and I know, and I've shared before, I have my own story, and I'm a physician. And when I had my first child, I was young and beautiful. And I was so humble because I was just like, well, I'm not going to tell them I'm a doctor. My particular doctor was not on call. Some other doctors were, but I was just like, well, there's no need for me to say I'm a doctor. I just want to be like everybody else. And so y'all can imagine, this was 19 years ago. And so I was young and round faced and probably looked younger than my age. And after I gave birth, felt extremely, extremely weak, to the point where my heart was in palpitations all the time. I couldn't stand on my own. My mama had to help me to even walk to the restroom. I couldn't stand in the shower. I had to sit down. I had zero energy. And the resident who would come by to see me, and the doctor who would later come by, the attending, they just kept asking what birth control pill I wanted to go on. And I said, I didn't want to go on birth control. And so I was saying, hey, I feel really weak. I can't stand on my own. Well, okay, well, you'll be leaving the hospital. They just kept trying to discharge me. And I said, well, I feel extremely, extremely weak. Like I can't even move on my own. Yeah. What birth control pill do you want to be on? And they kept asking me about birth control as if they wanted to be sure that I didn't bring any other babies. And it's just like, I was married. And even if I weren't married, if I say I don't want birth control, that's the end of the discussion. And if I'm telling you that I'm weak, that I can't stand, that my heart is beating, then you should listen. They didn't. So of course, finally, I had to go ahead and just, in the words of my grandma, let them know who you is, in the words of my grandma. And I just had to start spitting things in medical terms. And then my ex-husband's also a doctor. My father's a doctor. And so all of them, by the time I shared with them what was going on, everything was on 10. So then finally, they checked my blood count. And do you know what? I lost over half of my blood volume while delivering my first child. I had a normal hemoglobin, normal blood volume. When I went in and during the delivery, I lost over half of the blood in my body, and they tried to send me home. So do you know what likely would have happened had I got home still losing blood? Yeah, would have been one of the statistics of maternal mortality, Black maternal mortality. And so I say that to say it's not just a matter of education. It's not just a matter of socioeconomic status. Over and over again, the point keeps being shown that there is a systemic racism, a structural racism. And it's not just individuals. And no, it's not just that doctor and a nurse, it's a system. Because here's what happens. When you have systems of bias, then who gets hired? Who gets promoted? Well, the people who were chosen by ones who are already in that system. And so by the time you start having points of leadership, the people who have the bias are likely also the ones who are being promoted. So some things to do. And I want y'all to make sure you check out my post. I posted on social media. So listen, y'all, be sure to follow me at Dr.Frita on all platforms like IG, TikTok, Facebook, because I have different information on different places. So where I posted there, one, I shared some clips of when I was on the Don Lemon show talking about this, but then I also did the post sharing about the doctor and nurse being fired. And I had some of the most intellectual comments and responses of people rightfully feeling like that's not enough, them being fired, that's not enough. And they're correct. Other people were saying a cultural competency course, what's that going to do? They're like, Dr. Frita, you're saying unconscious bias, but some people know they're cruel. And I agree. That nurse who was sitting there cold as ice knew she was being cruel. There are still, we'll find, but there have been surveys of doctors who swear they're anti-racist, but some of them actually do have unconscious bias because of the system. And so, yes, a cultural competency course is proper, but also implementing protocols that regardless of your race, gender, you have to follow the protocols. That way things are more standardized, right? More black and white. Whereas if someone doesn't follow those protocols, then boom, it's easy to go in, to assess, to terminate, to correct. So this is just the beginning of the discussion, but thank you all for sharing some of your experiences. And we'll take a couple more experiences. And yeah, definitely make sure you check me out on my other social media platforms for the post that I did on my clips from the Don Lemon show, where I gave the update on the doctor and nurse being fired, and also go to the Don Lemon show channel to watch my full 20-minute conversation. It's very enlightening. I'm telling you, I quoted even more studies. I talked about this one study of children with appendicitis, and they found that the Black children received less pain control than the white children. It's amazing. I'm talking about standardized studies that have been repeated. It all goes back to implicit bias, unconscious bias, and a system of structural racism. You can deny it if you want to, but the data is there. We need to do something about it. Okay. Anyone else?
Yes.
Okay. We'll just take one or two more and then we'll keep it moving.
Okay.
And y'all, please make sure you give us a like. We're giving you evidence-based medicine here. Give us a like and a share. Let YouTube know we're here. It helps the algorithm. It's a free way to support the channel.
All right. This comes from Joseph.
Hi, Joseph.
No. I saw the video. I am an RN. I almost DIED because the doctor didn't listen to me. Ended up having to be admitted with chest tube inserted. Had a thoracotomy, VATS.
Thrombectomy. Okay. Wow. And see, there we go. You're an RN. So education has nothing to do with it. It's real. And I was watching another interview of a doctor, a Black male doctor, who went in to see an orthopedic doctor with knee pain. And he said the doctor went in, looked at him for a few seconds. Okay, yeah, you'll just be okay. And so the doctor started to walk out the door and he said, you know what? He said, I'm an MD. And actually, this is what I'm thinking could be going on with my knee. So then the doctor came back, evaluated him properly the way he should have. And then a whole other layer of treatment, everything else was opened up. But initially he was ignored. Yeah. And not due to lack of education. I'm sorry that happened to you. Thank you for sharing your story. And I really pray that you're doing well. But it's real. And it's actually difficult to talk about because, you have some people will be like, oh, y'all are just whining. Everything's not about race. Y'all are race baiting. We're talking data. We're talking real life experiences. It needs to be addressed, And as a physician, as a healthcare provider who's also been a patient and who's witnessed this, and y'all know, I like the evidence, I like the data, and I encourage you all to go look up data yourself on implicit bias. Get the black and white, look at the studies, and you'll see for yourself. So we'll see what goes on, and I'll definitely give you the updates. Yeah. All right. Speaking of updates, Shador, the CDC. Y'all know that I have been tussling with RFK Jr., who is the head of the Department of Health and Human Services. He's not a doctor. He's not an MD, not a DO, not a PA, not an RN, not an LPN, not a tech, not a custodian in the hospital. He's nothing related to healthcare. It's RFK Jr. And we know he's been a vaccine skeptic for years. Well, let's play this clip because it looks like it is all over the place as far as his thoughts on vaccines and autism and so on and so on. And sadly, it's making people lose faith in the CDC, which used to be the gold standard all around the world. But let's just play this and let's talk about the CDC kind of changing its mind.
Live picture of the White House, 7:27 on this Thursday morning. The CDC now has updated its website to say claims vaccines do not cause autism, well established, actually are not evidence-based. That's according to this new webpage that reads, studies have not ruled out the possibility that infant vaccines cause autism. Studies supporting a link have been ignored by health authorities. That's the new claim on the CDC website. There also is a notice that the Department of Health and Human Services is launching an assessment into the causes of autism. The webpage previously said studies have shown there is no link between vaccines and autism. HHS Secretary Robert F. Kennedy Jr., of course, long has been a vaccine skeptic, but he did promise in his Senate confirmation process the CDC would not remove language saying vaccines do not cause autism.
All right. Okay, I have a question, and I want y'all just to put a a little red heart emoji in the chat and tell me, what sources do you use for your health information? Name some sources that you use for your health information, because I'll tell you, prior to RFK Jr., and I still go back to old studies, for me, it was the CDC, FDA, World Health Organization. And now with statements like that, it's really becoming shaky. So let's just talk a little bit. All right. So yes, for RFK Jr.'s Senate confirmation, even some of the Republicans, and of course he was appointed by a Republican, Donald Trump, they have been, a lot of physicians are Republicans, and they're very pro-vaccine, the physicians who are Republicans. And they were making sure that he wouldn't change any of the vaccine language because they knew that RFK Jr. was a vaccine skeptic. He's wrongly stated that vaccines cause autism. He's wrongly stated that Black people perhaps should get less vaccines than white people, because he misquoted a physician's study about Black people and how we react to vaccines. And he's just given so much misinformation. And so now it looks like he's kind of, going back on his word, still having skepticism. I do want to make sure that I talk about the study that RFK Jr. is talking about back in 1998 in The Lancet, which really is quite a reputable medical journal. There was a study done of really just a handful of kids, just about 12. So even if you can call that a study, it was very tiny. And the physician stated that the MMR, measles, mumps, rubella, the measles vaccine, they stated that there was a high association, potentially a cause and effect of the measles vaccine causing autism. Okay, the study suggested that measles causes autism. Well, that study was reviewed and the scientists were investigated, and all but one of the scientists pulled their names from the study and retracted it because data was falsified. Okay, and it was an untrue study. Okay, they even had evidence to support that at least one of the physicians was actually putting in answers for the parents, okay, just to kind of make his theory come true. And all but one of the scientists retracted the study. The Lancet came back and retracted the study. They took it back. And for that one scientist who didn't, he was actually, his medical license was taken away. Okay, it was fraud, period. Since then, there have been multiple studies over at least 7 continents with hundreds of thousands of children, and there's no link found between the vaccine and autism, okay? And so there was that bit of misinformation in 1998, and it's been studied, undone. And for decades, as you all know, we've been getting vaccines because these vaccines have helped us. At one time, we thought we eradicated measles. But now there's been a big drop in the measles vaccine uptake, largely due to disinformation, like what RFK Jr. shares. We had the loss. 2 children lost their lives in Texas who got measles. They were both unvaccinated. There have been more deaths, and the measles rate has gone up higher than it's been in 30 years. Even whooping cough, another preventable disease with a vaccine, we've seen higher whooping cases than we've seen in years, specifically in Louisiana, where one of the Louisiana senators, who happens to be a physician, has pleaded with RFK Jr. to encourage people to get the vaccines. So bottom line, now we're actually seeing some of the consequences of disinformation, and we're starting to see diseases that were once eradicated. And so with the CDC having misinformation, it's very, very frustrating, because I have hung my hat on being able to trust the CDC, and now things are changing. And so I'm curious, did anyone answer with a heart emoji? Where do you all go for your scientific information, for your health information?
Yes, a few people chimed in.
Mm-hmm.
I remember Donna Michi. Hello.
Hi, Donna Michi.
She says the CDC initially, independent studies now.
Right. And you know what, Donna Michi, I still do go back and I look at the date of the CDC study, including when it was updated. And if it's been updated since RFK Jr., I have to pause. It takes more work. It takes more work. But also the good thing is certain societies, Donna Michi, I still will look at certain societies like the American Academy of Pediatrics. They have stood strongly on vaccines. I'll look at the American College of Obstetricians and Gynecologists, like for the OBGYN information. When that whole bit by the president who couldn't pronounce acetaminophen at the time, when he was saying that, acetaminophen was linked to pregnant women taking acetaminophen or Tylenol, he kept saying, getting autism. The different pregnancy societies, maternal fetal medicine, they came out against it. And so right now it looks like the societies have not been corrupted for the most part of what I've seen, including, American Medical Association, Atlanta Medical Association, National Medical Association. These associations are still standing strong on actual data. And so that's where I'm looking now, including older CDC studies. And if something changes, y'all know I'll come to the front and let you all know. And also anytime I disagree, not just based on opinion, but when I disagree based on evidence, because y'all know I keep it evidence-based, then I'll come here and let you know. Anyone else? Thank you, Donna.
Yes. Thomas, hello.
Hello, Thomas.
Thomas says, my own frame of mind.
Your own frame of mind. And that's kind of, it's upsetting because it shouldn't have to be that way, should it, Thomas? Because you said that you use your own frame of mind. But the whole point is that in a society, we each have people who specialize, right? So like if I want to build a house, I'm not an architect. And so I shouldn't have to depend on my own frame of mind, right? I should be able to count on the builders, the plumbers, the electricians, the design. I shouldn't have to because I'm not an architect, right? I'm not a pilot. And so when it comes to me flying a plane, I shouldn't have to deal with my own frame of mind. There should be a trust in society on the professionals who were trained. Okay. What I am is a physician. So I, as a physician, can depend on my own frame of mind because I have the decades of studies, of board certifications, of research, and I have learned how to research properly. Because a lot of people say, oh, I do my own research, but Google, ChatGPT, AI, that's not the same as how physicians were trained. And again, RFK Jr. was not a physician. And so some people's own frame of mind, and it has nothing to do with intelligence, but just training, can get them in trouble. Because for the people who are choosing not to get vaccines because of following disinformation, I'm sure these are perfectly intelligent people, and they think that you can trust the leader who was placed, by the president to head the Health and Human Services. And so it's really scary that, to have to depend on your own state of mind. You should be able to go to sources of people who are professionals. Thank you for sharing.
Absolutely. Karen, hello, Karen.
Hello, Karen.
Karen says World Health Organization as an RN for 40 years.
Very good. And have you heard, Karen, there was some pulling back from the World Health Organization and some information that we used to get, like for a flu vaccine, where the flu would happen on the other side of the globe and we would be able to get strains, and so that we could predict and make our own flu vaccines based on what hadn't come to us. And so it's always been very important, our connection with the World Health Organization, but we've also given them information. But now we've had, less somewhat of a division, which makes that frustrating. But I do find, as of now, the World Health Organization is quite reputable, but they've reportedly lost some of the information that we were sharing. And so I hope that this continues their strength. Yeah.
Mm-hmm.
And thank you for being a nurse for 40 years. Oh, that's a nice little minute. I love it. Thank you.
Absolutely. Couple on IG, they're chiming in today as well.
Hey, welcome from IG. Whoa. Now y'all saw I was busy on IG. So y'all saw where I posted the Don Lemon clips. You saw where I posted. Oh, listen. Yesterday I posted something on IG that's doing pretty well. I talked about the show The Braxtons. Did any of y'all watch The Braxtons? Put a capital B, BB, if you watch The Braxtons, because Trina Braxton's husband, Vaughn, showed up to Wanda's wedding, and he had been told by his doctor that morning that he needed to go to the hospital because he had high potassium in his blood, hyperkalemia. The level was 7, and he ignored her and took his tail to the wedding. And so then while they were there, and he was talking to another doctor. Now his doctor is a female, and he was talking to a male doctor at the wedding who found his numbers and said, you need to go to the hospital. not later, now. And so he went. And so I did a post on IG. You'll see it on Facebook, TikTok as well, and LinkedIn, where I talked about the dangers of high potassium, hyperkalemia, and how it literally can take your life. That's not an exaggeration. And just to put it in perspective, when you think about the lethal injections that are used for people on unalive row, like, prisoners who are sentenced to lose their life, they inject them with potassium chloride, because it stops the heart. Okay. And so guess what? When you have high levels of potassium in your blood, it can stop the heart. I've seen it. The most common cause of hyperkalemia or high potassium in the blood is kidney disease. Y'all know I'm a board certified kidney doctor. And so this is something that I've seen and I've treated. Oh, and for those of you who are new to me, I am Dr. Frita. This is the Dr. Frita channel. I am a board certified MD. I'm a medical doctor. I'm a board certified nephrologist, meaning I'm a kidney doctor and I have blood pressure. I have also been board certified in internal medicine, pediatrics, and obesity medicine. So make sure that you give us a like, give us a follow, and subscribe if you have not subscribed already. Follow us on all social media platforms. I give evidence-based information, and in my videos, I break things down in a way that's easy to understand, and so it can help you to understand your own medical issues. You can share it with loved ones, and so when you go in to see a doctor, you'll be able to pop just a few medical terms, okay? Let them know that you know what you're talking about. You know the squeaky wheel gets the oil, and so this is a way for you to advocate for yourself and to help your loved ones to advocate for themselves. We have over 917,000 subscribers here. So if you're not subscribed, please subscribe and help us get to 1 million. I thank you. Gracias. All right. Now what they say over in IG.
All right. MP.
Hey, oh, yay. Hi, MP. I love it when you join us.
Up to date, CDC and USTF.
Very good. That's good. And, I forgot about that. I use Up to Date also. And originally, one of the main editors was a nephrologist, a kidney doctor, if I may say so myself. But as of now, Up to Date is still very evidence-based, and you don't have to guess because they give you a plentiful list of their references. You can go back and cross-check. But yeah, those are good. Those are good. And like I said, I still do use CDC. I'm just careful on my dates and when things were updated. So if it's updated post RFK Jr., I'm just very, very careful before I go and repeat it. So good.
Yeah. And then Abigail from IG. Hello. Abigail.
Hi, thank you for joining on IG.
Uses NHS and NICE guidelines.
Okay. Yeah. So these are just some things to look at and to share. And one thing I'll also say, at least for certain news stations, I'm still seeing when they have physicians come on, they're giving pretty decent information, like News Nation. Oh, and I was just on News Nation last week. I was on there on my birthday also, Wednesday, November 19th. And what was I talking about? Children. Oh, can y'all believe this? The rates of high blood pressure in children have increased in a bananas percentage over the last 20 years. And so I talk about childhood hypertension. I talk about living with obesity. I talk about things to do to help prevent, because this was a study and they looked at kids who are less than 19 years old all over the world. They looked at over 21 countries and they found that all over, kids with high blood pressure, it's increasing. We know high blood pressure is a leading cause of heart disease, kidney disease, the number 2 cause of kidney disease, strokes, and now our kids are susceptible. So I'll be posting that this week. Just stay tuned. I'll be posting my News Nation. Oh, but I was saying that News Nation does still tend to have doctors who are evidence-based. When I've looked at CNN, they've been having evidence-based doctors, and even MS Now, which used to be MSNBC, not really falling into the propaganda of just, doing things just because the administration is doing them, but keeping it evidence-based. Okay. All right. Good. Y'all, please be sure to give us a like. It's really important. Share, go to your group me, your WhatsApp, go to your email, go to your text, and tell people, let them know we're here. Even if they can't see us now, please copy the link. This is evidence-based information, and it is here to enhance their lives. And you can always visit drfrita.com. That's my one-stop shop. Not only can you catch my videos, you can also see my favorite things, like my favorite blood pressure cuffs, my favorite juicer. I have a discount code for you. My favorite weights. Oh, to help keep me with my strength training. Oh my gosh, strength training can help to decrease your blood pressure, by the way, and help to decrease osteoporosis. All right. Well, y'all know it's time for games, even though this is a very serious day. Myth versus fact. Y'all, let's talk about Jesse Jackson. Put a rainbow in the chat if you remember Jesse Jackson and Keeping Hope Alive and the Rainbow Coalition. And we know that Reverend Jesse Jackson is an icon. He's a civil rights leader. He was one of the early ones, Black men running for president. He was a right-man hand for Martin Luther King Jr. in a lot of ways. And over a decade ago, he was diagnosed with a neurological disorder. He was initially diagnosed with Parkinson's disease. And then just this past April, they changed the diagnosis. They actually, really developed the correct diagnosis. And he has PSP, progressive supranuclear palsy. And so let's do a couple of myth versus fact statements, and then we'll talk about PSP.
All right, Dr. Frita. Before we jump into this, shout out to some of our members who are on with us today. Miss Rosalind.
Hey, Miss Rosalind, I missed you last week. I hope check out the members only videos, please. Hi.
Hi, Miss Andrea. Hey, she says happy belated BD.
Oh yeah. Thank you. Listen, y'all are tried and true. I mean, I can count on y'all being here to support us, and I really, really appreciate it. I appreciate everyone, and I definitely appreciate my replay crew. I can tell you members, y'all are here live, and so I appreciate y'all for marking that time. It really, really helps us, and I just like seeing you.
Absolutely. Then a couple more. Miss Patricia is here with us.
Hello, Miss Patricia. Look, ever since you joined, Miss Patricia, you've been riding strong, and you always participate. Thank you.
Absolutely. And Dr. Alice Cryer.
Hi, Dr. Alice Cryer. Yay. Thank you for being a member.
All right. Thank you, ladies. All right. So let's jump into the first question.
Let's go. All right. What's this first one?
Progressive supranuclear palsy, or PSP, is a rare type of Parkinson's disease.
Put an M1 if this is a myth. Put an F1 if this is a fact. I think I'm going to trick you. I always feel like Rumpelstiltskin, like I'm trying to trick y'all. I'm really not. I just love learning and teaching, and I like games.
All right. Statement 2. A single high-tech brain scan, like an MRI, can give a definitive diagnosis of PSP.
Okay. Can a single high-tech brain scan give a definitive diagnosis, like absolute definite? Put an M2 if that's a myth, and an F2 if that's a fact. Is that all it takes? Pencils down. All right. What do we have for statement 1?
All right. Statement 1 again. Progressive supranuclear palsy is a rare type of Parkinson's disease. We do have a mixed bag. On this one, Miss Aileen, hello, says a fact.
Okay.
Miss Rosalind agrees that it is a fact.
Okay.
Dr. Alice says myth.
Y'all better go with the doc. Okay.
Thomas says a myth as well.
Hi, Thomas.
Sunita, hello.
Hello, Sunita.
It's a fact.
Okay.
And there's another myth in here somewhere. Oh, Evelyn. Evelyn says it is a myth.
A myth. Okay. Now, this one was a tricky one for real, because we know that Reverend Jesse Jackson had a diagnosis of Parkinson's, but that was actually a misdiagnosis. Now, so PSP, or progressive supranuclear palsy, does have some overlap as far as similarities, but it's actually a different neurological disorder than Parkinson's. So we've heard of Parkinson's. We know that with Parkinson's, you can get a stiff face, often kind of a frozen looking face. With PSP, you can get a frozen looking face as well. With Parkinson's, you can lose some of your mobility. With PSP, you can lose some of your mobility as well. You can have anxiety and depression associated with both. But here are some distinctions. Now, for PSP, again, it's a very rare neurological disorder, and you get a degeneration or destruction of cells in the brainstem and the cerebellum, that little organ that sits kind of at the base of your brain, in your actual cerebral cortex, the main brain that you think of, and basal ganglia. You can get a degeneration or destruction of cells, and it can lead to problems with balance. And specifically with PSP, this is unique to PSP, patients tend to fall, but they tend to fall backwards. So for whatever reason, they do have a stiffness, but they tend to their heads kind of lean up some. And if they fall, they tend to fall backwards. That's just kind of a unique one of the symptoms. The other thing that's unique with PSP eyes. They have difficulty moving their eyes. They get blurry vision, difficulty looking down. And so a lot of times, when they're talking to you, you might think that they're disinterested, but they have difficulty focusing. Okay, so that's a PSP thing. Another thing is difficulty with swallowing, being able to coordinate a swallow with PSP, with the progressive supranuclear palsy. And with that difficulty swallowing, they oftentimes accidentally breathe food or breathe liquid into their lungs, which can lead to pneumonia, aspiration pneumonia. And the number one cause of death among people with PSP is pneumonia. And we know that Jesse Jackson was actually admitted to the hospital a little over a week ago. And at one point, he had low blood pressure that was requiring him to be on medications to keep his blood pressure up, vasopressors. And you can think that is a form of life support. He was on that. But then the last I saw, as far as the reports, he was transferred out of the ICU and he was not on a breathing machine and doing better. But so some other things that can happen with PSP, they can have inappropriate affect, meaning they might laugh when the situation is not appropriate for laughter, or cry when the situation is not appropriate for crying. And I've mentioned the anxiety and depression that can be associated with it. Most patients, after 3 to 4 years at least, will be wheelchair bound and will need quite a bit of help, in being able to move about and be mobile. So he's been diagnosed at least for over a decade with his neurological disorder, but just in April, they started calling it PSP, progressive supranuclear palsy. So while there are similarities, it is a neurological disorder. It is actually not Parkinson's. It is a different neurological disorder. So good. All right, let's read the second one again, please, Shador.
Yes. A single high-tech brain scan like an MRI can give a definitive diagnosis of PSP.
All right, what do we have?
All right. We have Karen says a myth. This is our AMP of 40 years. Miss Rosalind says a myth.
Okay.
Miss Aileen agrees, a myth as well. EJ, Brad, and Kai says
Hey, it's good to see y'all. Thank y'all for joining us.
Yolanda agrees, a myth as well. Thomas says a fact.
All right. Thomas wants to go stand alone. Okay, good. Okay.
All right. And Abigail on IG says it is a fact.
Is a fact. Okay. Thank you for joining us on IG. All right. So this actually is a myth. And while an MRI may be helpful toward the diagnosis, just one snap of the finger imaging the MRI is not a way to make a definitive diagnosis. There's a lot involved: the history, the physical, the symptoms, the physical exam, examining those eyes to see if you have, any type of difficulty as far as where you can gaze, getting that history of being unable to swallow well, getting the history of falls backwards. So it's not just a matter of being able to push a button, do an MRI and be done. If that were the case, he would have been diagnosed accurately over a decade ago, but they made a misdiagnosis. But it's just one of those things to remind you that in medicine, oftentimes there are complex measures to coming up with the diagnosis. All right, so good. Okay. And so anyone put any rainbows in the chat? Anybody remember Jesse Jackson from back in the day?
Yes, Miss Sherry. Hello.
Hi, Miss Sherry.
Put a rainbow in the chat.
Yeah.
As well as Miss Elaine.
Yep. So this was the Rainbow Coalition. And we know now in our society, rainbows kind of, mean a whole lot of different things. But Jesse Jackson was one of the originals with the Rainbow Coalition. And it largely meant, pushing for change, pushing for racial equality, pushing for, equity as far as in being hired, equity in healthcare, equity in financial gain, and just never giving up, keep hope alive. And again, if you take a look at my IG and at my other social media platforms, TikTok, the other ones, you'll see where I posted on, I believe I actually posted on November 19th, either November 19th or 20th. I think I did it November 19th, where I went through and I really went into detail about PSP, progressive supranuclear palsy. And I give even more details and also give some more details about Jesse Jackson specifically and what he went through. And also put some images up there of young Jesse Jackson. Was easy on the eyes now. He's a nice looking person now as well. But you get to see him standing right next to Martin Luther King Jr. And go take a look at that. So I give good information. I also give a nice little photo history of Jesse Jackson as well. All right. So please give us a like. Make sure you follow us on all social media platforms. So give us a like right here, please, while you're on here looking at us live, and share it. Go ahead and share it with the neighbor. Think of at least one person who likes a little evidence-based information. Give them a good share. And let's move into our second weekly dose, where I give you a fresh take on the headlines you simply can't get anywhere else. And let's talk about the kissing virus. Okay. Give me some lips in the chat if you've ever heard of the kissing virus. Okay, give me little lips emojis in the chat, and I'm sure follow it with this answer as well. So because the kissing virus, also known as EBV, Epstein-Barr virus, has been linked. There's been a Stanford study finding that there's a link between the kissing virus and lupus. So give me some lips in the chat, and I want you to write if you know of anyone who has lupus, systemic lupus erythematosus. Even if it's someone famous, a celebrity you've heard of, put some lips in the chat and let me know if you know of anyone who is living or has lived with lupus, including celebrities. So let's play this clip, and then let's talk about the EBV virus and how this kissing virus is linked to lupus.
Stanford say they've solved a medical mystery: why some people get lupus. Lupus is an autoimmune disease where the body's immune system attacks healthy cells. People with severe lupus experience fatigue, muscle pain, a skin rash, and even damage to internal organs. Close to 1 million Americans have lupus, and right now there is no cure. Stanford researchers tied lupus to one of the most common viruses in the world. It's called EBV. And it's in nearly all of our bodies. The virus can stay dormant for years, but in people with lupus, it causes their immune cells to go rogue and start attacking the body's tissues. Joining us.
Okay, so yeah, it's actually a big deal, this link that's been found, because we know about lupus. As I said, about 1 million people in the United States have lupus, about 5 million worldwide. Interestingly, about 90% of the people with lupus are women. Okay, are females, and oftentimes it's like childbearing age or even teenagers who will be diagnosed somewhere between the ages of 15 and 44 that you often get the diagnosis. There are men who have lupus. Also, Black women are at a higher risk for lupus. Asian women, Latina ladies or Hispanic ladies are at a higher risk for lupus. And it is an autoimmune disease. And so, when we talk about autoimmune diseases, we're talking about diseases where instead of your immune system just fighting bacteria, germs, viruses, it turns on you and starts fighting you. So the same way an autobiography is a book about oneself, an autoimmune disease is a disease that fights oneself. And so now we know that this EBV, Epstein-Barr virus, can be linked to lupus. And they found that almost 100% of people with lupus, they believe it's related to EBV. So how is that possible? Well, this is how it's possible. Mononucleosis, the kissing virus, almost everybody has it. 19 out of 20 Americans have EBV. And no, most people don't get any symptoms. And so if you're sitting there looking to your left and looking to the right, you probably have it too. And you can even get it like as young as being a baby, sharing a spoon, with your mama, or sharing a cup with your sister or with a cousin. And they call it the kissing virus because certainly by the time you get into high school or maybe middle school or maybe younger, I don't know what y'all are up to, if you share your first kiss, you share saliva, then that can put you at risk for getting it. And for most people, they do fine with it, absolutely. But they're finding that the Epstein-Barr virus can cause a manipulation in your immune system, in your B cells, that for some people, a certain percentage of people, it can cause you to have lupus. And what the big deal about this is that now that we know this, it can cause a big change in how we treat lupus. And they're even talking about getting a vaccine against Epstein-Barr virus, which could severely, incredibly decrease the amount of people who have lupus. Because guess what? With lupus, it can cause a whole lot of problems. It can cause kidney failure. Okay, it's a big cause of my young women, especially getting kidney failure, going on dialysis, needing transplants. It can also cause heart disease. We know that Toni Braxton has shared that she's living with lupus. She's had heart disease, lung issues. It can cause all kinds of stuff. It can cause lupus cerebritis or inflammation of the brain, definitely joint pains. It can affect the skin, cause rashes. And so do we have any lips of anyone who knows of anyone with lupus? And you could even mention celebrities. I mentioned Toni Braxton, but if you know of any other celebrities also, you can mention it next to your lips. And again, I'm putting lips there because we now know that the kissing virus has been found to have a link to lupus.
Yep, a few people chimed in. Miss Cindy Lee, hello.
Hi, Miss Cindy Lee.
Cindy said very close friend who actually passed.
I'm sorry to hear that about your friend. And here's the fact. Most people with lupus do okay. I mean, they'll have problems, joint problems, fatigue, things of that nature, but most live, long, pretty decent quality lives. But for about 5% of the people diagnosed with lupus, it can be fatal, like with your friend. So I'm sorry to hear that.
Absolutely.
Yeah.
Blue crystals. Hello.
Who is this?
Blue crystals.
I like that. Hi, Blue Crystals. Thank you for joining us.
Blue crystal says an aunt and cousin.
An aunt and cousin. And there can be a genetic component. So just make sure you're a regular at going and seeing your doctor, getting health checks. It's not something that's inherited in a predictable way. Like when someone has sickle cell, we know that if two parents are carriers, we can calculate the exact percentage of the chance their child will have sickle cell. It's different. And sometimes even if lupus directly doesn't run in your family, if someone has another autoimmune disease like rheumatoid arthritis, sarcoidosis, Crohn's disease, then that can put you at increased risk for lupus. And so I hope that your family is doing well. And just in general, I want you to make sure you take care of your health. Thank you for sharing with us, Blue Crystals.
Absolutely. NP says, I know of a friend, but she denies history of EBV.
Oh, guess what? I deny history of EBV also. Everybody I know, there's only a handful of people who I know of who actually know that they had EBV. So I'm glad you brought that up, MP. So if you actually get like symptoms and if you have the mononucleosis, well, then you'll get fever, you might get big lymph nodes and a fatigue that can last for weeks or even months, just a severe fatigue. Okay. And so that's for the people who actually get symptoms. But a lot of people don't have symptoms at all, which is why it's important to note that 19 out of 20 Americans have EBV. So for most of us, we don't even know if we have it. I don't know if I have it or not, but there's a 19 out of 20 chance that I do. And so even with your friend who denies having it, just statistically speaking, the likelihood is that she does. And so it'll be interesting after the study for her to go and kind of get checked out and see if it's even important for her to find out. Yeah, thank you for sharing.
Ms. Eunice says Nick Cannon, and she has several friends with it.
Come on to the front of the class. Okay, yes, Nick Cannon. And so that's a man. He got 11 kids, 12 kids. He's definitely a man, and he's living with lupus. And at one point, he shared that his kidneys were affected. No, he's not on dialysis, not transplant or anything like that, but that he had some form of lupus nephritis. And sometimes if you get acute inflammation, like a short-term issue with the kidneys, you can, once the lupus flare is corrected, you can go back to normal kidney function. But yeah, that's good. Nick Cannon. Anyone else?
Yep. Sherry says, I have 2 cousins and 4 friends with lupus.
Okay. All right. Thank you for sharing. And please, with your cousins and your friends, just make sure you spread the word to be, one, about the study, but also to be patient, because lupus is one of those invisible disabilities. Patients may look nice and cute and pretty and perfect, like Tony Braxton, like Nick Cannon, but they might really be fatigued. And I know in talking with patients and different medical panels I've been on with lupus patients, they say that's one of the most frustrating things. They might be planning to go out, hey, have a night on the town with their friends, but then that fatigue or that joint pain will just drag them down where they really just can't. They have no energy. And their friends look at them like, she don't look like anything is wrong with her. And they think they're backing out. But make sure you have patience with your friends with lupus, because it waxes and wanes as far as the symptoms. And just encourage them to make sure they see their doctors. And yes, I'm biased as a kidney doctor, but it's often very silent when you get CKD or chronic kidney disease related to lupus. We do have treatments. We do have management. So thank you for sharing. Okay. All right. Go ahead. Don't forget to give us that like. And we're going to slide in and talk about Joy Behar. Got an iPad toe. Let's play that clip, please.
All right.
iPad toe. That's her official diagnosis.
Now, I've been off for a few days, as you might have noticed.
What happened, Joy?
Well, here's what happened. So I dropped my iPad on my foot.
Yes.
And I broke my toe.
Yeah.
But you're still flexible, so I appreciate that.
She did.
And what they do is they put the toes together because it's broken.
Yeah.
And it's very, very, very painful. I do not recommend you dropping anything on your toe.
And wasn't Sunny trying to talk you into a bigger iPad just a few weeks ago?
Very sadistic of you.
I was.
But
If she had dropped that one, she'd be in traction.
She really would be. For me, Joy, can I just share this?
Yeah.
So we hear that Manny and I hear that Joy has dropped his iPad on her foot. So I texted Joy and I said, Manny's having office hours. Would you like him to go to your house to look at your foot?
Yeah.
And that didn't happen. But Manny said, have her send me a picture of her foot. And he asked you, Joy.
Tell us to go on Wiki Feet next time.
But he asked Joy, is there any swelling or bruising? Because that is a sign of a break. She said, absolutely not. No swelling, no bruising.
But there was.
When he got that picture, Joy, I mean, her third toe looked like her big toe. Come on. There was a lot of swelling.
Oh my goodness. She's laughing about it, but we know that the injuries are serious. And her iPad dropping her toe, hey, this is one of these tech injuries. And so we'll talk about some injuries that can occur related to technology. But what I want you to do, please, my good med heads, my good folks in the chat, make sure find an emoji of either a computer emoji or a smartphone emoji, some type of a technological device. And I want you to answer this question. Have you ever had an injury related to technology, like your computer dropping on your toe, your iPad dropping on your toe, or something going on with your body based on your positioning when you're using your technology? Put that in the chat. Also, answer this question. Have you ever had what you thought was a minor injury, like Joy Behar thought she had, and then you found out that it was a little more serious than you thought? So give me a little computer emoji or a little smartphone emoji and answer that. But yeah, let's talk about these tech injuries. Okay, iPad toe. I don't think you'll find that if you look in any of the medical journals or any of our medical textbooks. But she dropped her iPad on her toe, and it sounded like she just really didn't pick up on the symptoms. And we know that we know that Sonny's husband, Manny, Dr. Manny, is an orthopedic surgeon. And so he clearly was able to see that the toe was swollen, it was black and blue. And she said she couldn't see it. And they asked her if her husband, if Joy Behar's husband, she's like, he's blind, he didn't see it. And so she really could have ignored a toe fracture. And, that could be a problem because it could have healed in a deformed manner. She could have been, unable to walk for longer than anticipated. And so what they had her to do was tape her toes up in a buddy system. It looks like it was her third toe that was actually broken. And so they taped it up to the next toe, and that forces it to keep proper alignment and to stay straight and to heal, no surgery or anything like that. And doesn't sound like it's a major complication. But the thought of using your technological devices and them causing injury can be an issue. There's something else people can get, something called tech neck, okay, or like a cervicalgia, like an inflammation or an issue in your neck, your cervical spine, and it comes from bending over and looking at your computer, right? Because when you're holding that head, your neck is tilted forward at like a 45-degree angle, then it can be almost the equivalent of having a 50-pound weight on you. And that can cause some issues as far as pain. It can go on to be musculoskeletal issues where you have tightness in your upper back. And for any of you who ever get massages, I know, I got me a good old massage on Wednesday. And they always tell me when I get massages without fail that I'm very tight in my upper back. And I know that comes from sitting here and being on this computer, and getting kind of that tech neck. So that's something. So did anyone share, any of y'all share if you have any issues that you've gotten from tech devices? I hope you didn't get iPad toes, but do you ever feel like your upper back or that look, even there's something.
I think kids during the
looking at
had us
on social media today,
right, Dr. Frita?
Office chair. Someone called it OCB, office chair, but where she talked about where you're sitting down all day and your bottom kind of starts to spread. I don't know how technical and scientific that is, but we do know that when you're sitting too much, that can decrease your metabolism, your mobility, which is why I recommend those desks where you can actually stand on your desk. That way you can get a walking pad and be exercising while you're at your office job. Did anyone join in with any tech injuries or any minor injuries they found out were more serious than they thought?
Yes, Audrey. Can you hear me, Dr. Frita?
Are you on mute, Shador?
No, I'm not. Hello.
Uh-oh. I don't hear you, Shador. Is that me?
I don't know. Can anyone hear me? Yes, no.
Oh, that's not me. Shador, can you hear me?
I can hear you. Can you hear me?
Uh-oh. Listen, in the chat, can y'all
Okay, let's say they
Give
can
me a
hear
thumbs
both
up if
of
you hear
us.
Shador, because I don't hear her.
I need to alert her.
Oh boy.
1 second, guys. It must be her.
All right, we'll give it just a couple of minutes. Meanwhile, y'all make sure that you go ahead and give us a like. Make sure you give us a follow. And yeah, and be careful with your technological devices. And keep the conversation going, please. Keep the conversation going in the chat. Okay. We've talked about quite a few things today. We've talked about the women in labor. And if you're comfortable, I want you to share your experiences even further. If you've ever felt like you were unheard or that you were unseen, please go ahead and share those conversations. And also just make sure that you do your best to get evidence-based information, which is definitely what I give you here. Again, if you have not subscribed, if you're not following us, please do join. I am Dr. Frita, and I'm an MD, and I have a book I want you to make sure that you get, Under Pressure, A Guide to Controlling High Blood Pressure. And it's a way that I give you information not only on natural ways to deal with your blood pressure, but also some traditional, ways like with medicines. And we talk about kind of a good all around 360 way to deal with high blood pressure. And again, I am a board certified kidney doctor and high blood pressure specialist. I have a new video coming out tomorrow, so be on the lookout for that. And it's one I like. It's I talk to you about how to get off your high blood pressure medications safely. And the key point is that please don't stop medicines on your own. Consult with your doctor, but I give you some tips on things you can do with lifestyle to help you to lower your blood pressure naturally. So you don't want to miss that. Make sure that when you subscribe here to our YouTube channel, that you put the notifications on. Also, make sure you join our membership. We do have our members only live. We have that on every the last Monday of every month, right after we finish with our celebrity health and our hot health topics in the headlines. And if you want to have any conversations with me one-on-one, I do offer a telehealth concierge service, or one-on-one. I get your full history and I can talk to you. Again, I'm board certified in nephrology. I have been board certified in internal medicine, pediatrics, obesity medicine, and I read medical journals every single day. And so I love to share information. And so if you want to have a one-on-one consultation with me, then do make sure you join. Shador, can you hear me? Can you hear me?
I can hear you. Can you hear me?
Uh-oh, I still don't hear you.
No.
I don't know if it's just me or if it's the chat. If they can hear you. Anyway, we've had a power-packed show today, and so we're going to go ahead and close it on out. I thank y'all for joining, and as always, I appreciate you. Make sure you do follow me on all social media platforms, and of me on News Nation this past week, Don Lemon Show. Those videos are up as well. And just check out those multiple short form content videos. All right. I appreciate y'all. I appreciate you, Shador. And I thank you for making Monday your healthiest day of the week.